Hello friends, uh, we are now today discussing the very important topic of pediatric sensory examination, and it is paramount important to have a knowledge of what basics we should follow while doing a sensory examination, because at the time of case presentation often it becomes very haphazard when we have lack of time for eliciting the history, doing the general physical examination and all the components of the central nervous system examination in the relevant case. So often we find that the while in CNS examination, the adult examination is very easy because of a cooperative adult who is able to give us a very good for verbal feedback of questions, and we are able to do complex tasks like dermatomal mapping or graphesthesia, etc. In pediatric patient, we often find that the situation is quite opposite, and we have mostly the patients who are, because of their age or because of their condition, they may be non-verbal and uncooperative, and most of the examination findings are lying on the objective observation of the examiner. It is very important that we keep the developmental maturity constraints in mind. We should not expect the patient to respond appropriately to those questions which are asked to the patient. For example, if we ask a patient the question of higher mental functions to a very small child like 3-year-old, it may not be very relevant. So these are the very limitations of the pediatric examination. So we have two tracts: spinothalamic tract, which transmits pain and temperature, and dorsal column and the medial lemniscus, which transmit the light, touch, vibration and proprioception. We must test both pathways to ensure the complete spinal cord integrity. For example, we may get a case of spinal disease like TB spine, and there may be a problem only with the dorsal columns. We may be having a case of transverse myelitis with complete loss of all sensations. So we will come to know only when we test all the modalities. So what all sensations can be checked? The most basic ones are the superficial pain and temperature sensations, which are carried by the lateral spinothalamic tract. These sensations are present across all the ages and they require minimal processing, and through testing or by observation you can come to know the sensation part. The higher level consists of vibration sense and proprioception, which requires a calm patient and who has a spatial awareness, and the highest most sensations which require the cortical interpretation of the stimulus. They are requiring a very actively cooperative and highly alert person to respond to our testing. So according to the patient's age and developmental maturity and condition, we should have a standard expectation what responses we are going to expect in these three areas. Always we use a cotton wisp for light touch, and we should test the dermatome systematically, bilaterally, and compare two sides on bare skin and never on the across the cloth of the patient. Pain is best avoided as a sensory modality because it turns the patient very uncooperative, and it may be avoided in some cases because the same pathway is carrying the sensation of temperature. So alcohol swab or test tube with warm water can be used, or cold water can be used for temperature sensation, which both of the pain and temperature are carried by the spinothalamic tract. So we can use pain sensation dull pinprick in a higher age group person, which can be taught about expected response, but not in a small child. So dorsal column testing is done by the appropriate use of a 128 Hz tuning fork applied on the bony prominences, and proprioception is done by moving the digit up and down while holding the digits by the lateral aspects. We should not commit the error of holding the digits, for example, our fingers, from top and bottom approach, because the patient can guess the movement based on the pressure applied. So these are the sensations which require a alert patient who is having a good cognition and can cooperate with our questions and testing. Higher level sensations like parietal lobe, and which test the parietal lobe integration, are those which are the brain's ability to interpret the peripheral nerve signals. And two of the common techniques to use are stereognosis and graphesthesias. One error that mostly the students commit is that while attempting graphesthesia, they should be able to understand the ability of the patient, what symbols or numericals the child can recognize. A small child of 3-year-old may not be able to recognize the alphabet or numerical figure, and stereognosis is usually tested by placing the familiar objects which are familiar to the child, which come in daily contact with the child, to the patient. We should not commit the error of giving our own objects to the patient. Often we have a very agitated patient because of environment or because of the condition, and we should always be ready to have a case who is a pre-verbal infant. So these are the situations which make the students very anxious and fuzzy, and mostly the mistake committed is that they tend to fight with the situation and make the patient more hostile. So the best approach is a very playful approach, and try to calm the child, distract the child, and use the responses of the child for the response to our sensory stimulus, and turning the entire thing into a game-like process for a toddler or a bigger child will turn the situation very favorable to you. So these are the tricky areas, and this is the photo showing a grimace response which can be recorded by us. And the most commonly mistake applied made in this observation is to differentiate between true perception and spinal reflexes. The spinal reflexes are rapid stereotypic responses, and they occur at the spinal level. The true perception of pain, temperature, or any sensation is accompanied by facial expressions. So the patient's face should always be observed while applying the sensory signals like touch and vibration. So never ask the leading question, does this feel sharp or does this feel cold? Always ask open-ended questions. How do you feel? Is it sharp or is it blunt? That should not be asked in the question. Testing dermatomes through the clothing is never a good idea, because it can dull the stimulus, and the precise anatomical localization on bare skin should be done. And patient should be held in a cooperative manner with our interaction with the child, and we should not move unpredictably without warning. For example, testing the sensation of touch from the face directly to the lower limb. So these are the situations which make the patient very uncooperative and surprised. So the most sensitive points to remember while doing the sensory examination are: we should adapt to the age to have an expectation of what should be testing and what are the kind of responses we are going to have. The anatomy remains constant throughout the ages, so we can test the spinothalamic and dorsal tract, and there are ways, the same ways as in adults, and we should always use our interpretation keeping the facial responses in mind so that we don't confuse with spinal reflexes with the sensory stimulus. It is very, very important that we should avoid giving the painful stimulus and to a very small child or a toddler, and we should try to maintain the and protect our rapport with the child. It is very tough situation while doing the CNS examination because we have to do the motor examination also, higher mental function, and all these cranial nerves, etc. they have to be recorded. So while doing the sensory system examination, keep on having a look, indirect look at the by your observation over the patient's ability to move the limbs, and doing a rough having a rough idea of the cranial nerves and the motor system while doing the sensory examination. So that will save our time, and that will also help in rapid assessment of the patient. Important point I want to convey is that in this presentation I have not taught you how to test and what to do, but it is important that we carry our toolkit properly every day and practice more and more on patients, present our cases, and become better every day. So this is the thought I want you to carry in the mind through this presentation. Thank you for watching, guys.